employer-provided insurance. And last year I hosted a Medicare or an open enrollment panel, and a big chunk of the questions we got were questions about Medicare open enrollment, and we weren't at the time prepared to answer those. And so that gave us the idea to put on this panel here tonight. And I'm just so excited to be able to respond to our readers and to respond to your interest, and be able to host this event tonight to answer your questions and help you get the resources you need to make the decisions that are best for you. So I want to acknowledge tonight that this event is being sponsored by Kaiser Permanente. Kaiser Permanente is both a medical provider and also a provider of health coverage. It has more than 1.8 million Medicare members nationwide. And to learn more, go to kp.org. I'll be introducing our panelists here in a little bit, but before we do, a little bit of ethical housekeeping. I just mentioned our sponsor, and of course, without them, this event would not be possible. But as I said, tonight's event is really about providing you all with the information that you need to make the best decision for you. So none of our panelists are here to endorse or to favor any one provider or company above another. They are just here to provide you with that information. I know we got some questions from people kind of asking us to do the shortcut. What is the right plan for me? What should I choose? And we're not going to answer that, but I think by the end of the night, you will hear from our panelists the information you need to be able to do that for yourself. So first off, I want to introduce Brandon Davis. Brandon is the head of the state's SHIP program, which we'll be talking a little bit more about. He's a Medicare expert with the Colorado Division of Insurance. Next, we have Louise Norris, who is a health policy analyst for the informational website MedicareResources.org. And Louise is really just kind of a national treasure when it comes to information on health insurance and health policy of all kinds. So I'm really excited she's here tonight. And last, we have Greg Glashinsky. He is a longtime volunteer with AARP, and he's currently serving as the interim president for AARP Colorado. So that's quite a role to be taking on a volunteer basis. All right, so we're gonna dive in here, but before we do, all of you have the opportunity to ask questions of our panelists tonight. You can do that two ways. One is by sending an email to questions@coloradosun.com. The other way is by using the chat window where you're watching this, so either on the Colorado Sun homepage or on YouTube. All right, I think that covers all the introductions. So Brandon, I wanted to turn to you, and let's just talk basically about what we're doing here. What is Medicare open enrollment? What kind of things can you do during open enrollment? And how long does it last?
Pretty much Medicare open enrollment, which is from October 15th through December 7th. I love to tell people basically this is your time, okay? This is your time to think about the past year, what has gone on with your current plan that you're with. Has the customer service been good? Have all your drugs been covered? Is your doctor currently taking what you're taking, or will he be changing up plans? Those are some questions that you need to be asking yourself right now during this time, because you can compare plans. You can go from original Medicare during this time with your red, white, and blue card to a Medicare Advantage plan, if you like, with a private company, or if you're already with a private Medicare Advantage plan, you can switch back over to your red, white, and blue original Medicare card. Pretty much, once you decide what you need to do, if you participate in Medicare open enrollment, and you also get a new plan, the new plan starts January the 1st of the next year.
And Brandon, I mentioned the SHIP program. What is that?
The SHIP program, the State Health Insurance Assistance Program, is a federally funded program administered through the U.S. Department of Health, basically to answer your Medicare questions, just flat out, because we understand how confusing Medicare can get with all the different parts and also the programs that can help. There is a program out there for you. Just think of us kind of as that local neighbor that knows a lot about Medicare. We don't endorse any plans. We're an unbiased source. We can't even tell you, pick that plan. We can't do that. We can just tell you these are your options and also give you the information. And from there, you make the decision as an informed beneficiary. We are that unbiased.
And these programs are locally based. Obviously, you're with the state, but they're based locally.
Yes, they are locally based. We currently have 16 SHIP programs throughout the state of Colorado. Uh, our local number, which is 1-888-696-7213. It geolocates to your local SHIP program based on what county you live in.
All right. I told Brandon I was going to hold this up, so true to my word here, in case you missed that. And we also have it in the chat or the comments on YouTube.
So yeah, so whatever questions that you have, go to that number and we'll be able to clear things up for you. And we also help out with plan comparisons during this time as well for people, and also enrollments also. And all of the SHIPs, they operate through Medicare.gov. We don't have a special system that we work with or anything. The same thing that beneficiaries use, Medicare.gov, that's what the SHIP counselors use.
Awesome. And Louise, I wanted to ask you about whether there's anything new this year that people need to be aware of. Maybe they've had Medicare in the past, but what are some new wrinkles this year they need to know about?
Yeah, there are quite a few new things this year. One of the most exciting ones is that there will no longer be out-of-pocket costs once someone hits the catastrophic level in Part D, which is a really good change. This stems from the Inflation Reduction Act that passed last year. So basically, if your drug costs aren't high enough to get you to that catastrophic level in Part D, this won't change anything for you. But if you're on high cost medications and you've been hitting that catastrophic level, then you know that you were paying 5% of the cost of your drugs for the rest of the year. And with really high cost drugs, that can really add up. So starting in 2024, if you hit that catastrophic level, your drugs you don't have any more costs for your covered drugs for the rest of the year, which is a huge improvement for folks who do have high cost medications. Another change that'll help some folks who have low income is that the Extra Help program, the low income subsidy, is being expanded. Basically, in 2023, and the way it's worked in the past is there's two levels of that program. There's a partial extra help, and then there's full extra help, and that depends on your income. And so for 2024, they're bumping it up so that the folks who were previously just getting partial extra help will get that full extra help. So you do have to have low income. It's 150% of the poverty level is the cutoff for that. And then there's also an asset limit. But if you feel like it can't hurt to try and look and see if you qualify for that, because if you do, it's a pretty significant benefit in terms of keeping your drug costs really low. We are seeing a lot of changes in the premiums for Part D plans, for standalone Part D plans. There's increases and decreases. So kind of all over the map on that. If you're enrolled in a Part D plan, you definitely do not want to just let it renew for 2024. You really want to take the time to look and see if the plan you have is the best option for next year. And if not, this is like Brandon said, this is your time. This is your chance to make a change. There are the normal changes that we see every year in terms of deductibles, out-of-pocket costs. The Part D deductible on standard plans is $505 this year, and it's going to $545 next year. We see those sort of changes each year. The Part B premium and deductible are both going up. The deductible is going to $240 for Part B, and for the premium, it's $174, but just under $175 a month. So those are things people just need to be aware of. The Part A premium, very few people pay it, but if you do, it's staying pretty steady, not really changing. But then there are increases in the Part A pocket costs if you do go to the hospital or need skilled nursing care, stuff like that. The thresholds for having to pay the high income surcharge for Part D and Part B That's increasing. This year it was applicable for a single person earning $97,000. Next year, the threshold bumps up to $103,000. That is based on your income from 2 years before. So for 2024, whether or not you have to pay that surcharge is based on your tax return from 2022. But we always like to remind folks, if you have had a life change that makes it so you're no longer earning that sort of money, there's an appeals form you can submit so that you're not stuck paying that surcharge when you're no longer high income. See, the maximum out of pocket on Medicare Advantage plans is increasing again, but a lot of plans are well below. They have a maximum out of pocket well below the federal allowable level. So just pay attention to your plan might be changing. So it's just in your best interest to always check that and not let it automatically renew.
Is this a normal level of changes, or are we seeing more now than what we usually see?
The part about the expansion of the low income subsidy and the elimination of catastrophic costs in the catastrophic level of Part D, those are new and specific to that legislation from last year. All the rest of those things we pretty much see each year. They just it varies from one year to another how significant they are. But yeah, it's just, I mean, it's one of the things we know from looking at folks across the country is that it's very common for people to just let their Medicare plan renew without going in and actively comparing. Mm-hmm. And I mean, that is what the majority of people do, and that is definitely not in your best interest. And so, especially when there are big changes in premiums, big changes in benefits, you really do need to take the time during open enrollment to just check and make sure you're not leaving money on the table or benefits for next year.
Wow. Okay. Thanks, Louise. And Greg, I wanted to ask you, so you are not just an AARP expert, and you're also a Medicare beneficiary yourself, right?
I am, yes.
So this is not your first rodeo. You've been through this before. What do you think people need to know when they hit their open enrollment period?
Well, first of all, Medicare can be very, very confusing and sometimes difficult to navigate. So use the Brandons and the Louise people out there to help you if you can. Another thing to make sure that you do is to consider, when you're looking at plans, make sure you consider your out-of-pocket expenses, like your premiums and your deductibles and co-insurance and co-pays. Those things are real important. And then also look at your Social Security yearly benefit sheet that they send you or you get online. Make sure that you look at what they're deducting. So they're deducting a certain amount, and you may also, depending on what type of plan you have, also have a monthly payment to an insurance company, like for supplementals. And I think Louise could probably speak to that a little bit more than I could, but consider those sorts of things. Make sure that your doctor or healthcare provider, any healthcare provider, it takes Medicare assignment. Now, that's the technical term. I've noticed when I've asked that of the person when I call into an office, they don't even know what I'm referring to. So I have to say, well, that's where you take Medicare patients. Oh yeah, we do. Or no, they don't. But in most cases where I've called, yes, they do. One of the other things, and I think Brandon can probably attest to this, is that people spend more time planning their vacations than they do looking at a plan for their Medicare, for Medicare. Take the time and look at it. And also be your own patient's advocate. It's very important that you're that. No matter what plan you choose or whatever you end up doing, make sure you're your own patient's advocate. And take a look at your monthly explanation of benefits. And I've done that consistently, and I've seen invoices come from a hospital or another healthcare provider come in, and I'm supposed to pay this amount, and I'm going, well, wait a minute. I know that this was paid by the insurance company. I go back, look my record, sure enough, there it is. And so I call them up and they go, oh, yeah, well, disregard that bill. Well, so you've got to be your own patient's advocate on this sort of thing. So,
yeah,
and that's pretty much.
Brandon, if I can jump to you really quickly, you've mentioned when we were talking before about some homework that people kind of need to do, some documents that really help for them to round up, and also people that they should be contacting just to make sure that they're picking the right plan. Can you run over that for us?
Oh, yes. I want to bounce off what Greg was saying. It is really important to look at any type of paperwork that comes in to your mail as far as your health plan. On a quarterly basis, you may receive a Medicare summary notice if you're on original Medicare, or you might get that explanation of benefits if you're on a Medicare Advantage plan. I know it says across it, this is not a bill, and you're tempted to just sit it to the side, but at least take 5 minutes to look at that, because that's your best way to catch something if it's not right. You might see some type of heart surgery that you had in Alaska. You've never been to Alaska in your life and everything. That's something that you might want to take a look at. And some of our ships across the state, they also coexist as a senior Medicare patrol as well, which is another federally funded program, which focuses on the other side of Medicare, and that's Medicare fraud prevention. In the event that you do see something kind of wrong with those summary notices, you can take those and report those to the Senior Medicare Patrol, and the Senior Medicare Patrol can provide you with next steps to kind of look at the situation and monitor it, and then we can receive a report from you. That way we can report it on our end and shoot it to the U.S. Department of Health and Human Services, and then they can analyze it to the point that maybe it goes to the Office of Inspector General at that point to go towards investigation.
Mm-hmm. And you had also mentioned when we were talking before about people kind of need to know themselves. They need to know their needs. You know, what drugs do you need? Which doctors do you want to see? And then actually be active in going forward and making sure that you're talking to those people directly to say, hey, what do you accept?
Yes, during this time, during open enrollment, just like Greg said, also, you have to do your own legwork. I would suggest, like I said, if all of your drugs haven't been covered during this time, you know, you might want to look into doing a plan comparison. Check with your doctor or the billing department at your clinic and see, okay, is my doctor going to be taking Medicare? Okay, well, what kind of Medicare are they taking? Will it be original Medicare, or will it be Medicare Advantage? All right, if it's Medicare Advantage, go even further. What company will they be accepting? Are they taking Humana? Are they taking Cigna, Anthem? Really grill them and everything. Grill your doctor or the billing department. That way you can come in equipped and knowing, okay, I'm gonna do a plan comparison, but this is what I need to get right here whenever you speak to a ship counselor during this time.
All right, well, why don't we dive into what was by far the largest source of questions that we've received from readers and viewers. And this is about what I would call the alphabet soup of Medicare. Parts A, Parts B, the missing Part C that isn't really called Part C, the Part D. We've already sort of mentioned them already. Louise, I thought maybe you could explain for us, what are all these things and how do they differ?
Sure. So there's original Medicare or traditional Medicare. That is Medicare Part A and Medicare Part B. Part A is your inpatient coverage, and Part B is pretty much everything else. It's your doctors, it's durable medical equipment, it's physical therapy, it's stuff like that. Part A and Part B together are original Medicare. It does not include prescription drugs, which is that's why we have Part D. So Part D is your prescription drug coverage. Part C, as you mentioned, is people don't really refer to it as Part C, but that's the other name for Medicare Advantage. So Medicare, if you get original Medicare, you're getting Part A and Part B directly from the federal government. Most people don't have to pay for Part A because they paid for it while they were working, but everybody pays for Part B. If you want to get your Medicare from a private insurance company instead, that's Medicare Advantage. And basically what that does is it gives you the benefits from Part A and Part B all wrapped together in one plan from a private insurance company. And most Medicare Advantage plans also include Part D. And most of them include other things like vision and dental and, various extra things that aren't included in Medicare Part A and Part B. There are pros and cons to each, which we're going to get into in a little bit. We do have I wrote a resource on medicareresources.org, helping people go through, making this decision, because it's a very personal decision. But just to highlight a few of the differences. So original Medicare does not have a cap on your out-of-pocket costs. So, and it also doesn't cover prescription drugs. So most folks who go with original Medicare are going to get some sort of supplemental coverage. Some people have it from an employer. If you're a retiree and your former employer offers retiree coverage, you might find that that's enough to supplement your original Medicare. If not, you can buy a Part D plan on its own and a Medigap plan or Medicare supplement plan to supplement your original Medicare. If you get Medicare Advantage, it's pretty much all in one plan. So if you're doing, it depends on how much you want to pay versus what sort of coverage you're getting. With Medicare Advantage, it's a private insurance company. They set their own network. They have their prior authorization requirements. You have to stay within the network. It's more sort of along the lines of what people would get with maybe an employer sponsored plan. Original Medicare, you have access to doctors nationwide. There are no networks. It's just like Greg said, if they accept Medicare assignment, you can go anywhere you want in the whole country. And virtually no prior authorization requirements. The coverage is there. And then if you have Medigap, it picks up those out-of-pocket costs that you would have with original Medicare. So there's not a one size fits all on this. Some folks prefer Medicare Advantage, some prefer original Medicare. You just need to know you just need to have a very educated decision when you're making the decision. And one of the things to keep in mind is that we have this annual open enrollment period that we're in right now, and it's for Medicare Advantage and Part D, but it is not for Medigap. So if you enroll in a Medicare Advantage plan, and then 5 years from now you decide you want to go back to original Medicare, you can do that during open enrollment, but you might not be able to get a Medigap plan because those are medically underwritten, which means the insurance company looks at your medical records to see whether they'll take you. After that initial enrollment window you basically get like one shot at Medigap. There's a trial right. You have a year to go back to Medigap, but it's not forever, and it's not an annual opportunity the way there is for Medicare Advantage and Part D. So I think that is an important thing for folks to keep in mind in terms of the differences. But that's a kind of in a nutshell, original Medicare versus Medicare Advantage.
Yeah. Brandon, how do you help people decide which one is right for them?
It's basically kind of how Louise said. It is a personal choice, but for instances, we kind of let people know, like, hey, what is your retirement looking like? Do you see yourself traveling often or hopping from state to state? Mm-hmm. If that's the case, then you might want to stick with the red, white, and blue card for original Medicare, since it is good nationwide. But if you are kind of staying within the area, close to Colorado, or if you're wanting something kind of like the HMO or PPO model, then original Medicare Advantage might be your best bet. Or if you're wanting those little perks like Louise mentioned, the little dental cleaning or the little vision appointments, you might want to look towards Medicare Advantage instead. Now, even though Medicare Advantage does have dental and vision benefits, like I said, they're small benefits. Don't think you're gonna get a tooth extracted or some surgery on your ear or anything. Anything big like that, you might want to also supplement that Medicare Advantage plan with a standalone dental and vision insurance if you're in need of tooth extraction or surgeries of any kind. But the Medicare Advantage plan will have you as far as the little tooth cleanings and things of that nature.
Greg, I am already overwhelmed trying to process this information. How do you make a decision? How do you tell your friends, like, here are the things you should look at and here's what you should consider?
My initial statement to most people when they ask me is to look at not what your health condition is right now, but what do you think your health condition is going to be 10, 15 years from now? You know, you turn 65, you're eligible for Medicare. So what's it going to be 10, when you're 70, 75, 80 or more? Take a look at what your health condition is now, what you think it might be in the future because of your health condition now. And also you have to look at your own pocketbook. What can you afford? So those are the things that I tell them. I know that's really an open statement, but it does go back to the personal choice that you've got to do your own soul searching, so to speak, to figure out what you think is going to be best for you. Understand that insurance is insurance. I don't care if it's car insurance or health insurance, house insurance, insurance on art, whatever it is. It's typically just in case. So that's what you're paying for, just in case. Medicare is a little bit more than that because as you age, you are going to need to go to the doctor more often. So,
Brandon, are there downsides to switching back and forth frequently in open enrollment periods? Sort of trying traditional Medicare, then trying a Medicare Advantage, and then switching back?
No, not at all. Especially if you do it during this time, during open enrollment, there's no penalty during this time if you want to switch from original Medicare to Medicare Advantage or from Advantage back to original Medicare. Like I said, like Greg and also Luis said, just know what you want as far as soul searching, as far as your health conditions. Mainly, like I said, your drugs, if they're covered, also if your doctor's in network. Those are kind of the main factors. But yeah, during this time, there's no penalty. And Medicare, it is kind of a game of when sometimes, as far as special dates that you may have. For example, after open enrollment, let's say during open enrollment, you signed up for a Medicare Advantage plan or enrolled in a Medicare Advantage plan. Then once January the 1st comes around, I kind of get a little bit of cold feet. Like, I don't know. I might be going back home, back down south frequently. Maybe I need to go back to the red, white, and blue card. Okay, from January the 1st through March 31st is what's known as the Medicare Advantage open enrollment period. There's this one time only part where you can switch back to original Medicare if by January the 1st you enrolled in a Medicare Advantage plan. It is kind of the cold feet period for Medicare Advantage plan enrollees.
Oh man.
I know it's a lot.
It's so much, you guys.
Yeah.
Okay, so let's
once again, contact SHIP if you have any questions.
Yes.
Yes.
We've talked about SHIP. Louise has mentioned her website, medicareresources.org, that has Medicare resources, but there's also Medicare Brokers. And Louise, I was wondering if you can we got some questions on how they work, who pays them, that kind of thing. Can you just kind of give us the rundown of how brokers work?
Sure. So brokers are licensed by the state, so you can always contact the Division of Insurance if you're meeting with a broker and you want to just check and make sure their license is in good standing and they are who they say they are. You can check. That's on the state website. Brokers are paid commissions by the insurance company, so you don't pay for their services. For Medicare Advantage and Medicare Part D, the federal government sets maximum commission levels and then the insurance companies, there are no minimums, but the insurance companies set commissions within those guidelines laid out by the federal government. And for Medigap plans, it's typically a percentage of the premiums. I would say if in doubt at all, if you feel overwhelmed, if you feel like you're likely to maybe just skip it and just let your plan renew, it's always in your best interest to have someone helping you. So you can reach out to SHIP, call Brandon's office. If you want to work with a broker, word of mouth is a great way to find Medicare brokers. Check with family and friends, see if they've used a broker, see if your doctor's office has a recommendation. And then once you get you call a broker and you start talking to them, I would say interview them. Think of it like you would a realtor or someone who's going to help you with stuff. Ask them questions like, how long have they been doing this? Ask them what insurance companies they work with. Get a feel for whether it seems like they're pushing you towards one direction or another, because as we've talked about, this is very personal. For some folks, original Medicare plus a Medigap plan and a Part D plan is going to be the best fit. And for other folks, maybe they can't afford that. They need a Medicare Advantage plan. So a broker should be asking you questions to figure out what works best for you. They shouldn't be trying to pigeonhole all of their clients into any one solution. So you really want to get a feel for how they handle that. And then, once you've interviewed somebody and you feel confident working with them, you can explain your needs to them. You want to make sure you're talking to them about what medications you're taking, what doctors you need to see, make sure they're explaining to you what your out-of-pocket costs would be on the various options you're considering. And then they can help you get this sorted out by December 7th so that you're in the right plan for next year.
Greg, do you have tips on how to find a broker?
No, I don't actually.
Okay.
Louise actually has a good, her statements were, that's the way that I would approach it also.
I would say there is a national brokers organization called NABIP, the National Association of Benefits and Insurance Professionals, NABIP. And so it's nabip.org, I think, and they have a broker lookup on their website. So you could, if you were at just like an absolute dead end and wanted to find somebody, you can go. You have to kind of hunt on it. It's kind of under the little menu option in the upper left-hand corner, and kind of those three lines that you click on, and it pulls it down, and you can search for a broker in Colorado or wherever you want. So Brandon, I wanted to go back to this question of penalties. Sometimes people are working past the age of 65. They're now eligible for Medicare, but maybe they want to stay on their employer-sponsored plan. Are there any penalties for you're eligible for Medicare and you just kind of want to take a pass the first time around?
Oh, yeah. This is a question that our SHIP councils get all the time, as far as people that working past 65. Just as Louise mentioned, all your working life, you've paid into Medicare, 10 years paid into Medicare or the FICA on your check as you see it, and you have enough working credits. You're usually offered premium-free Part A, meaning you don't pay for Part A whatsoever. You're entitled to it. You might as well just go ahead and take it. Part A, that's on the red, white, and blue card. There'll also be Part B on the card, but you do have the option to hold off on it because you're still working and your job insurance is just as good as Medicare. So you can't go to Social Security and be like, hey, I would like to hold off on Part B for now because I have job insurance that's good. But let's say, all right, I'm fixed to retire. Like this is it right here. I'm gonna be done working. We suggest everyone either go to your HR or to the plan directly and get what's known as credible proof of credible coverage. Basically, it's a sheet of paper describing I've been on this insurance for so long. It's just as good as Medicare. That's the reason I did not take Part B at the time. Take that piece of paper, go back to Social Security, show them this paper, and then they'll understand that, okay, you did have job insurance that was credible and just as good, so you don't get a Part B penalty. The same will work for the Part D also, since job insurance also has drugs as well. So whenever you sign up for a Part D plan, you'll also waive any penalties because you have that proof of credible coverage.
Could I add something? Make sure that what Brennan had said, make sure that you do that way ahead of time, because not all HR departments know how to deal with it properly, is my understanding talking to some people that I know. They have run into some hurdles, and it's taken a while to be able to get that sheet of paper to hand into Social Security. So make sure you do that well ahead of time. So,
and if I could tack one more thing on there too, if you're a procrastinator and you don't get to it well ahead of time, you only have 8 months from when that job-based coverage ends. They give you that special enrollment period, but it's not indefinite. You do need to get on it.
Great. Can I ask you on another topic that is of big concern to people, which is, okay, I picked my plan. I picked traditional Medicare. I picked Medicare Advantage. I have a doctor that I want to go to. How do I make sure I can actually see that person? Since sometimes doctors will not be taking new Medicare patients, or there's a wait list, or there's some other kind of restriction. What's your best advice for ensuring access?
First of all, if you want to keep your own doctor, call them and ask them. That's the first thing. I mean, that's what I did for myself and for my wife, and find out. And any other specialists that they may send you to, also, while you're after your doctor says yes, and you go in and you say, okay, well, the doctor said, I want you to go see a specialist or some other healthcare provider for this or that. Make sure that they have Medicare assignment, that they take Medicare assignment also. If you have a Medicare Advantage plan, make sure, and let me say this again, make sure that your doctor, before you sign up for it, that your doctor is within that network. Even the insurance companies don't keep their lists of doctors up to date properly. So again, call your doctor and find out if they, the particular Medicare Advantage plan that you're going to sign up for, that your doctor is in that network.
Brandon, do you find on those Medicare Advantage plans that if a doctor is in network, access is usually good there? Like, does a Medicare Advantage plan improve access at all, or is it just the same as doing traditional Medicare in terms of trying to find a doctor who will see you?
Like how Greg said, it's pretty much the same both ways, but it is on you as the beneficiary to do your research. And if you can, get things in writing, if you can also. That way they can't say, well, I said this, but at the same time, though, things have changed, and it's like, no, I have it here in writing that you said that you would take this when I came and asked you during this open enrollment period.
And I'll add some doctors won't take in new Medicare patients, but they'll allow their existing patients who transition to Medicare on. They'll then take that, that continue to take that patient on through Medicare, and then work that way. I've seen that happen quite a bit, so keep that in mind.
So I wanted to get to some more reader questions, but first of all, just a reminder, if you are watching tonight and have a question for our panelists, you can send it to questions@coloradosun.com, or you can drop it in the chat function wherever you're watching, whether that's YouTube or on our website. So I wanted to get into some of the basics on shopping for plans. If you don't go to a broker, you're trying to look for yourself and you want to say, well, what's available in my area? What is actually being offered to me in my area? Louise, what advice do you have there? There's an exchange kind of site that people can go to, right?
So Medicare.gov has a really user-friendly tool. It's medicare.gov/plan-compare. So it's their plan comparison tool. And you can, if you're already on Medicare, you can log in there. There's an option to log in onto your Medicare account, and that way it'll have all of your prescriptions, your pharmacies. You don't have to input all those again because it'll pull from your account. If you are, just aging into Medicare, you're not on Medicare yet, or if you're doing this to help out a family member or friend, you can do it anonymously. But it basically lets you put in your zip code, and then you can tell it what you're looking for, whether you want to look at Part D plans, Medigap plans, or Medicare Advantage plans. Keep in mind, like I said earlier, Medigap is not open enrollment right now, but you can sign up for it when you're first eligible. But the Medicare Advantage plans and the Part D plans, everything that's available in your area for 2024 will show up on there. And you can put in your, if you are doing it through the anonymous tool where you aren't logged in, you can look and see put in your specific medications. We always recommend folks try multiple pharmacies. Don't just get stuck in a rut and assume you want to keep using the pharmacy you've used in the past, because you might actually find you can save some money by switching to a different pharmacy. So that is a really good tool. I highly recommend it. It shows you everything that's available, and it shows you what your costs will be. You tell it what medications you take, and it'll total it up and say, if you go to this pharmacy, your out-of-pocket costs plus your premiums are going to equal X amount, and at this pharmacy it'll be this amount. It's a great resource.
Mm-hmm.
Oh yeah, and to piggyback off of what Louise said, even if, let's say, you don't even want to get online or deal with that, or you just want someone to do that for you, the SHIP program, they have been trained to use Medicare.gov as well, to do the legwork for you in that sense, and also to do the plan comparisons also. Mm-hmm. So yeah, so if you're, a little low on the computer savvy side, that's okay. The SHIP program is here to help.
Mm-hmm. Brandon, question for you. How can people estimate their costs based on whichever option they end up choosing? There's just like such a constellation of things that you could cobble together and to create your coverage. How can people end up figuring out, okay, what's my final cost going to be, and what do I actually need to make sure it's covering? What would my healthcare costs be without assembling some of these plans together?
Well, basically, like I say, it does depend on what you choose as far as what route, as far as Medicare you go, because not only do you have on the original Medicare side your Part A premium, which is most likely, you don't have to pay anything there, but you also have to have that, you have to pay that Part B premium annually. So there's that. Then, like we said, you got to have a drug plan. So you have to attach that there. There's another premium that you pay to a private insurance company as well. And then also, as Louise mentioned, there's Medigap. Because most people, there's this myth that Medicare pays 100%, and it doesn't. Medicare, keep in mind, pays 80%. But and then you're responsible for the other 20%. But if you don't want to deal with that 20%, there's where the Medigap comes in, where you pay a separate company to handle that 20%. So that's kind of how, in retrospect, how your cost is covered 100% with a Medigap attached to original Medicare A and B plus your D. Then on the Medicare Advantage side, which have out-of-pocket limits, an out-of-pocket limit, basically, let's say you go to the hospital for surgery and it's $10,000. Well, you got your Medicare Advantage plan here. They have an out-of-pocket limit of $7,000. Okay, I'm out of the hospital, got the surgery done. They gave me the bill. Out of pocket, out of my own pocket, I'm done paying the $7,000. After that, your Medicare Advantage plan handles all the rest of the cost. And that's also another reason why you can't have a Medigap with an Advantage plan, because of the out-of-pocket limit that an Advantage plan has. It's actually illegal for someone to sell you a Medigap if they know you have an Advantage plan.
Louise, you mentioned some restrictions around Medigap, but are Medicare Advantage plans, can they be underwritten? Can they take into account your health circumstances in deciding how much to charge you? Can they do benefit limits? Can they kick you off after you've hit a certain amount that you've received in a year?
No. So with Medicare Advantage, you can only apply, you can only submit an application and enroll during when you're first eligible for Medicare, or during this window that we have going on right now through December 7th. And then, as Brandon mentioned earlier, that Medicare Advantage open enrollment period in January, that goes from January to March, will let you go back to original Medicare or switch to a different Medicare Advantage program. So there's some flexibility there, but the rest of the year, like if you decide in June that you just want to sign up for Medicare Advantage, you can't do that. Medigap is different. So when you first are eligible for Medicare, you get a 6-month window when you can sign up for any Medigap plan that's available in your area. And it doesn't matter what your medical history is, they have to take you. If after that is over, say 5 years down the road, you decide you want to sign up for a different Medigap plan, you can apply anytime you want. You can submit an application any time of the year, but that's when the insurance companies can take a look at your medical history and see whether or not they want to take you. So Medicare Advantage and Medicare Part D have limited enrollment windows, but it's guaranteed issue. Medigap has that one enrollment window at the beginning where it's guaranteed issue. After that, you can apply anytime you want, but it's not guaranteed issue, if that makes sense.
So if somebody decided to have a Medicare Advantage plan for their first couple years of eligibility and then switched over to traditional Medicare and decided, oh, I want to get a Medigap plan as well, is that guaranteed issue at that point? Or that would be
No, so you have a 1 year, they call it a trial right. So either when you're first eligible for Medicare, or if you go to Medicare Advantage right away, or if, say, you've been on original Medicare for 5 years and then you want to go to Medicare Advantage, basically your first year in a Medicare Advantage plan, you can switch back to Medigap, switch back to Medigap, guaranteed issue. After that, no, the insurance company has the option to take you or not, or charge you a higher premium. So no, it is definitely not guaranteed issue access to Medigap further down the road. And that kind of goes back to what Greg was talking about earlier, where when you're 65, if you're 65 and you're very healthy and active and, health is going great, you don't want to just be making your Medicare decisions based on how you are right now. You want to, and I know it's hard because who knows what the future is going to bring, but we know that as time goes on, you're probably not going to be as healthy when you're 85 as you are when you're 65. But that is why you do kind of want to be making your decisions looking at the whole big picture of what do I need right now, in addition to what I need down the road. And as Brandon was talking about earlier with penalties for Part D, and Part B, a person who's 65 and doesn't take any medications at all might be tempted to skip Part D and just say, I'm not going to sign up. Well, that's a mistake, because if you 5 years down the road, all of a sudden you're prescribed an expensive medication. Not only you have to wait till open enrollment to sign up, you can't just submit a Part D application in June, and there's going to be a penalty attached to that. So even if you're perfectly healthy and you take no medications when you're 65, you still want to get yourself on a Part D plan. You can pick the cheapest one available if you don't take any drugs, but that gets you into that system so that you then have the opportunity later to switch to something else without a penalty.
Like
Okay.
landmines everywhere.
Could I back where Louise had mentioned, and also Brendan, a little bit about Part D. Something people don't consider is that within Part D, which is prescription drugs, there are 5 tiers that drugs are listed in, and you will pay accordingly under Part D a out-of-pocket expense for that. And something that people do who do use Medicare and who do have prescribed drugs find out that that prescription drugs can be very, very expensive. And depending on what tier it is, you're going to end up paying quite a bit of money out. So understand what tiers, and it's hard to do when you go to sign up to say, well, can I take a look at the formulary? Because that's what they look at, is the drug formulary. Can I take a look at the formulary before I decide on this plan? Because that's yet another thick book that you have to go through and look. But still, you can look at other older ones online. I've come across different companies that publish them online and look at the year before and kind of get an idea of what tier it might be in. And it may move up a tier or down a tier, depending on the drug. But consider that also, and especially if you're already on Medicare, take a look at what tier your drug that you're taking is in. So when you're looking at plans for next year.
And that is the nice thing about that Medicare plan comparison tool is they do the work for you. If you put in your drugs, and it'll ask you to be very specific, what drug are you taking, what's the dosage, and it'll basically sort through that big thick book that Greg's talking about and figure out like exactly what you're going to pay for those drugs. And if you're overwhelmed by using that website, like Brandon said, the ship counselors are trained in using that. Medicare brokers are very savvy. They'll ask you to they'll have you give them a list of your drugs and they'll do it for you. But you definitely don't want to just, randomly guess at something, because it's probably not going to be the best plan.
We have a question here from a viewer who asks if an insurance company can refuse to take somebody if they want to switch their Part D plan or their Part D company.
No, not during this open enrollment period. All of the plans that show up on Medicare.gov in your area, they're all guaranteed issue for you. It doesn't matter, what your medical history is or what drugs you're taking. This is open enrollment, so it's definitely open.
Okay, I want to get to one more question here. Of course, the folks who are interested in information about Medicare don't just include people who are potentially recipients of Medicare. It also includes people who act as caregivers for those recipients. And we had some questions from folks about how they, as a caregiver, can get started in helping somebody sign up. So any special advice for caregivers, especially? Brandon, do you want to start?
Off the top, contact us at SHIP. I know it's a go-to. It seems like it, but that's pretty much the simplest way I can put it, is to contact us at SHIP. Like I said, 888-696-7213. That's the number. And then our SHIP counselors can go over the steps with you as far as what you need, as far as going to Social Security, because Social Security, they act as the gatekeepers of Medicare. They let you in, they let you out. Other than that, you're pretty much going to the SHIP program or broker to get your information.
And
And
sometimes
it is,
yeah,
you
sorry,
can
go
use
ahead.
that Medicare plan comparison tool. Like I said, you don't have to log into the person's account. You can do it anonymously. I remember many years ago doing this for my father-in-law, way back before I was even doing this. And it was, they make it very intuitive, very user-friendly.
Mhm.
So if you have a loved one that you're doing this for, you can get into that tool. You can do it anonymously without logging into their account. You can put in their zip code. You can put in drugs they take, and it'll help you at least figure out how to get started. And then call Brandon's folks at SHIP
Yes.
to help you make sense of it.
So
And
sometimes there are people who are eligible for both Medicare and Medicaid. Are there any special considerations there in terms of their Medicare open enrollment, and how can they make sure that those services like really mesh together well?
So there are Medicare Advantage plans designed specifically for dual eligible folks. Those, if you're covered by Medicare and Medicaid, you can take a look at those and see what you think. Definitely, there's more enrollment flexibility, more opportunities to change plans when you're dually eligible. You qualify for that extra help, subsidies to keep all your costs really low. I would say if you are eligible for both, you're going to want to talk to some folks at your local Medicaid office, because they will be very well versed in the different assistance programs that you're eligible for, that can help you just make sure you're not spending any extra money that you don't need to spend, and making sure that you're really in the coverage that's going to work best for you.
Mm-hmm.
exactly. And our SHIP counselors, they can also assist people with those cost savings programs, as far as what's known as the Medicare Savings Program that helps out with Part B cost. And also the Extra Help Program, as we mentioned earlier, which helps out with Part D costs. We tell people all the time, don't be afraid to ask about these programs to help assist with costs. In fact, currently CMS has done like a study, and they feel like people who are enrolled in the Extra Help Program, they feel like there needs to be kind of an even number of people maybe signing up for the Medicare Savings Program as well currently. So yeah, take advantage of these programs if you're income and asset eligible, or at least ask about them.
Mm-hmm. I want to get to just a couple more questions here. We had some folks asking if they need a supplemental dental plan or a vision plan, or maybe they need hearing aids. How do they find those plans, and how much is actually covered by a Medicare Advantage plan or traditional Medicare?
One stated, like I stated earlier, if you know that you need, once again, it goes back to knowing in the future, if you know you need to get some serious dental work done, or maybe some hearing procedure done, a major one, then you might want to look into getting that separate or supplemental dental or vision or hearing plan. Because like I said, Medicare Advantage, they do offer those little benefits for dental and vision, but once again, it doesn't cover a full-blown surgery.
Mm-hmm. And
I would say also
yeah.
it really varies from plan to plan. Like if you're, you'll see notes online that say like 98% of Medicare Advantage plans cover dental. Well, that may be true, but like Brandon's saying, some of them it can be pretty minimal. Some of them it can be pretty good. We're seeing improvements, I would say, in terms of the benefits that are being offered, but it's very plan specific. So if you are looking at dental and vision benefits, make sure you really read the plan you're looking at. Like, what is it going to cover? What's the maximum benefit that they'll provide? Once you hit that maximum, you're on your own as far as paying for additional dental care.
Mm-hmm.
And there is lifetime also. As I remember,
yeah.
There's a lifetime limit on some of those too. So
right. So just pay attention to the details. Going back on, it is not going to be covered on original Medicare, routine dental, hearing, or vision. Original Medicare does cover things like cataract surgery, things that are not considered routine vision, but it's not going to cover like your check up at the optometrist or glasses or anything like that.
Yeah.
I would say with hearing aids, if you have a Medigap plan, check and see with your audiologist whether they give a discount because they partner with some Medigap plans, and you might find that you get a discount on your hearing aids. Even Medigap doesn't cover hearing aids, but you might find that you can pay less by telling the audiologist, showing them your Medigap card. So always check that before you just fork over out of pocket for hearing aids, because those can be expensive.
And for hearing aids also, they're coming out with some pretty good ones over the counter. So
yeah, that's a really good cost savings
too.
That works for your needs for sure.
If I can squeeze in one last question here before we go. So people who are eligible for Medicare right now are probably just being like inundated with phone calls and ads and all sorts of things. And some of these are offering really kind of interesting perks that are outside what you would usually think health insurance would cover. And Greg, I was wondering for you, how do you evaluate those? Do you take in those into consideration, or how much do those, or should those matter to somebody?
I switch the channel if I'm looking at TV. Again, you've got SHIP, and then you've got the CMS's or Medicare's webpage that you can go on and do comparisons. That's the way that I'd go. I just don't myself. I don't pay attention to those ads. I seriously, if it's on TV, I switch the ad. If I'm listening to it on internet radio, I switch to a different station, or I put my own music on, my own playlist, whatever. I don't pay any attention to them.
Yeah, I would agree that like the things that are sort of the bells and whistles, those are great once you've picked the coverage that works for you. You don't want to make your coverage decision based on bells and whistles. You need to really drill down to, the whole purpose of this is to, I think, as Greg alluded to earlier, this is for like worst case scenarios. Like what is going to happen to you if you get diagnosed with cancer? What are your out-of-pocket costs going to be? Where are you going to be able to go to get treatment? Those are the sort of things that you need to be really, really making your decision based on. What doctors can I see? What drugs are covered? How much am I going to spend over the course of the year on my medical care? The extras are just that. They're extras. They're like frosting on top of the cake. You want to make sure your cake is solid before you start worrying about the frosting.
Couldn't agree more with Louise and Greg. It's health insurance. Think about your health first. I know it's appealing. They said that they'll give you rental assistance. They'll even give you some money for groceries and everything. But no, think about, your health as far as your drugs and your doctor being in network, and just down the line, your overall health first.
Yeah.
And a lot of those benefits, like once they start talking about things like money for groceries, if you look at the fine print, those sort of benefits are for people who are like chronically ill. It's not just universal. It doesn't just mean everybody on the plan gets them. So you don't want to be don't assume anything when it comes to your health benefits, but those sort of, you might be thinking, oh, that sounds really great. And then it turns out you're not eligible for it. So think of your medical needs and the big picture. That's what's important.
Okay. Well, and I think on that note, we will wrap up here for tonight. So I want to say just huge thank you to our panelists for coming on, sharing your expertise with us. And I hope everybody watching tonight found this useful. So I want to let you know that if you want to go back and watch this video again, if you want to share it with somebody, we will have it posted to our Colorado Sun YouTube page. Should be here shortly, so you can find it there. I'm also planning on writing a story with some of these tips, so you'll be able to find it there as well. And if you like what we do at the Colorado Sun and you're not already a member, you can go to coloradosun.com/join and sign up. Memberships start as low as $5 a month. And we have a lot of exciting stuff happening. If you're interested in more Colorado Sun events, we'll have one on private insurance open enrollment that will be coming up next month. You can go to coloradosun.com/events. So again, just want to make a note tonight that tonight's event is made possible by Kaiser Permanente, and you can go to kp.org to learn more about them. Want to say a big thanks to our panelists one last time, and wish everybody a good night and good luck in this open enrollment season. So take care.